I feel like I've heard so many different stories about how people were diagnosed with their endometriosis, but here's mine. If you're new to this channel, my name is Letitia. I do lifestyle and DIY, and I am very passionate about women's health and women's sexuality. And if you want to see more of this, be sure to click subscribe and turn on notifications. I have always had a heavy period. I just didn't know. I just thought it was normal. I had cramps just like everybody else, and I wouldn't say that my cramps were they were awful, but I've heard worse. Looking back, I realize how severe things were. I would run through a super jumbo tampon within an hour. Girls would talk to me about, using pads and stuff, and I wasn't able to use pads ever. There's just no possible way that a pad could have caught anything in time. So I would always sleep with a tampon and an overnight pad. Sometimes still leak through. Cramps were really bad, but I've heard of people that vomited, that passed out. So then I was like, well, I've never gotten to that point, so I don't think it's that bad. This will come full circle, but every time I had period poops, they were so painful. It was almost blackout painful, but it felt like I was giving birth even though I didn't know what giving birth was. Whether I was home alone or with Stefan, we had a system in place on how to manage the pain, hot water bottles, naproxen. I have tried so many different contraceptives, not really for the intention of managing my periods, but I've reacted very poorly to a few different types of birth control pills that my family doctor prescribed. I tried a less and my hair was falling out, Lolo, and then I tried the NuvaRing. In general, I'm just really bad at taking pills on a regular basis. Otherwise, because it didn't have the original intent of managing my period, it obviously didn't do anything for my period. I run on a 3-week cycle, which means that eventually I get 2 periods per month. My periods normally lasted 6 to 7 days. So you can imagine that it was pretty tiring losing that much blood. I can't believe I lived that long with it and just didn't know. I went to the doctor one last time because I was moving to New York and I was like, well, American healthcare, I definitely need to get a checkup before. And then he sent me for a uterine ultrasound. And in the ultrasound, they found some pretty big cysts. And then that's when my mom kind of took over. My mom works at a hospital that specializes in oncology. And so, of course, she had all the hookups. But actually, this is not a well-known fact in Canadian healthcare system. You actually have the right to ask your family doctor to refer you to the exact person that you would like to see. Sometimes, family doctors will refer you to who they know or other private practices, but if there's somebody that you think is worth seeing, then they can't stop you from it. And I hear this all the time, but you have a lot of doctors that have a lot of ego issues that just refuses to refer you, and they can't do that. Actually can push and explicitly ask for that referral. My family doctor is great. I've seen him since I was a baby, and he listens to my mom they're tight. So she said refer her to the gynecologist at my hospital. She's a gynecological oncologist expert, so she specializes in ovarian cancers, other related reproductive system cancers. So obviously I'm kind of just a pity case, and I went through an MRI. And so again, an MRI, you can't find out if you have endometriosis until you go under the knife and they see the scar tissue physically. MRI can't pick it up, ultrasound can't pick it up. It's just a better diagnostic tool to look inside, except that all signs pointed to endometriosis. It's the most probable cause to all the symptoms that I was presenting. So that was when I was referred to my dream gynecologist, which surprisingly is a dude. I'm very uncomfortable with men looking at my body, touching my body. It's just, I can't stand it. It makes me itchy. He is a doctor that specializes in endometriosis and fertility. My first exam with my doctor included a pelvic exam, I think another ultrasound. During the pelvic exam, he'll insert a finger in and then press down on specific areas and ask if there's pain. We talked about how I nearly black out when I poop. He just seemed completely unfazed by everything I was telling him. And we talked about possibly having children. Because he's a fertility expert and he deals with so many patients, I feel like he forgets. But every time I see my doctor, he'll be like, "So are you planning on having children?" I know that this is a question that he gets all the time, and this is something that he has to plan ahead in terms of what he has to do with my treatment. He said that my previous birth control was just low doses of hormones that was not as effective, and he suggested trying an IUD. And I've always been interested in an IUD. After asking my family doctor about it, he said, "IUD is meant for older women, and I don't know if I recommend that for you." That is a huge misconception. IUD is a great effective form of contraceptive, and I tried the Jades first. It's a 2.5-year IUD. It is much smaller than the Mirena. The Mirena is this big, the Jades is this big. It was just a way to see if it would manage my symptoms, so make my periods lighter and manage my cramps. So getting the Jades, it was painful, but it was pretty manageable. I only spotted for a little bit afterwards. I also have a video where I talk about getting my IUD inserted. You can watch that as well. I highly recommend you find a good practitioner to do the insertion technique. Do not go to your family doctor to do it, because your family doctor is a general practitioner and you want somebody that specializes in gynecology to do it for you. Insertion technique can affect many different things in terms of where the IUD sits in your uterus, how painful it will be, and how much downtime you're expected, and spotting that's expected afterwards. So I saw him, I think, once every 4 to 6 months after that. It seemed like things weren't improving. My periods were a bit better, but my cramps were not. And so I think after a year, in one of our follow-up appointments, I was like, okay, I don't think things are getting better, and the pain is still quite a lot. So then we talked about what our next steps were. This is where the talk of surgery comes in. I was presented with 2 different options. There is a hormonal pill that I could take. It's a pill that you take daily. It is not a contraceptive, so I would still need to use birth control with it, and it's meant to manage my symptoms and my period. I do need a contraceptive anyways, and I also can't take pills on a daily. So then the other option was the surgery. The idea is that we start with a clean slate, since I've had scar tissue build up since my first period, and I can keep my Jades in and at the same time remove the cysts that were potentially dangerous, because one of the cysts was blood filled, and if a blood filled cyst bursts, apparently it's an emergency situation. So we thought might as well start clean slate. The idea of a surgery is very tempting, except that there is no cure for endometriosis. Scar tissue continues to come back every 2 years. A lot of women that are trying to get pregnant, they'll have the lap done, and because you have a fresh, clean uterus, immediately try and get pregnant. If you're not ready to have children and you get a lap done every 2 years, for example, that also affects your chances of getting pregnant. So it's a double-edged sword. I had the privilege of not even having to consider that option, and I decided to opt for surgery. That's where you can watch the surgery video that explains the whole process. I know it can be overwhelming for a lot of people. It was a day surgery. I didn't stay at the hospital. I went home the same day. I was on my feet by the next day, shuffling and walking fully within a week. Man, have I heard some horror stories from other people who, I don't know if it's the American healthcare system, but they've had to stay in the hospital for a long time, which means that, you just collect more on your bill. But because universal healthcare in Canada, I didn't have to pay for any of it, and they wouldn't try to keep me at the hospital because it would cost them more money. The typical lap procedure has 3 incisions. He had to make 4 incisions, And these are my scars now. I can't even find this one. This is just underwear line. Or no, it's this. My mom was in awe. She said, "Oh, he makes such beautiful incisions," which is such a like healthcare worker thing to say because I had no idea, but she is right because I virtually have no scars. On the follow-up, when I saw my doctor again, he said, "A lot of your scar tissue was around your uterus, but it climbed up towards your rectum," which explains my period poops. It was completely enlightening. I'm so glad that there was finally an answer. So after that, we waited for the rest of the JDES to expire. I think I had a year and a half left. And then I moved on to my new IUD. My new IUD is a 5-year IUD. It is the Kylina, and it's the same size as the JDES. It just didn't exist when I first got it. Same size as the JDES, but lasts as long as the Mirena. So remember the sizing difference. It's been 2 years since the surgery. At this point, I feel like my cramps are starting to come back a little bit. Like I can sense that there's a difference from since I had surgery to now. So I will be making an appointment with my gynecologist again to see if things get worse or if it's just something that I need to monitor. Again, I don't want to be going under the knife all the time. My periods, on the other hand, are so light. Like, they are still on the 3-week cycle, which is whatever. I pretty much only need to wear panty liners and then maybe like a regular tampon for a day. I don't remember what that life is like. It's amazing. I am very happy. And then a perk of taking out the scar tissue and the cysts, because cysts can also affect your hormones, is it pretty much eliminated my acne. My skin before and my skin now, completely different. In terms of side effects of the IUD, I have none. And I am very happy with the treatment plan that I have been put on. If we were to look at a timeline of this was a span of over a year and a half of maybe even almost 2 years from the moment I went to the family doctor to finally deciding to get surgery. It was a process. It wasn't just like, oh, we're going to get surgery. If you're suffering from similar symptoms like me, where your periods are really heavy and it seems abnormally heavy compared to your friends, like talk to your friends about their periods. Yes, I think it's a good thing. Your pain is unmanageable, where you're frequently taking painkillers or it's inhibiting you from living your regular life. Absolutely, you need to advocate for yourself. I've had great healthcare professionals help me along the way, but not everybody is as lucky. It starts with your family doctor. If your family doctor is going to be a dick about it, you absolutely need to advocate for yourself and push for a referral for a specialist. I do recommend seeking a specialist at a hospital. That's just what my mom has taught me. With my gynecologist specifically, he serves on a board. Even on a personal level, he was incredibly caring. I remember telling him one time, I think the IUD makes me pee a bit more. And he said, okay, I'm a little concerned that maybe you have a UTI. Let's get a urine sample as well just to rule that out. And then he sent me to do ultrasounds like every 6 months. Sometimes I wouldn't even do the ultrasounds because it was just a lot. He was just so thorough, so kind in his approach that I knew that I could tell him anything and I didn't feel threatened or intimidated into doing anything I didn't want to. Just trust your gut. If you feel like your doctor isn't hearing you or listening to you, because pain is a very subjective thing, always seek a second opinion. Because endometriosis is so hard to diagnose, there have just been so many different stories that I've heard. So if you have a story of your own, please let me know in the comments. And if you have any questions, you could DM me on Instagram at Letitia-a. And I hope you can subscribe to this channel to support more of these types of videos. Thank you for watching.